Hey everybody, I'm Dr. Willardsen, and today I wanted to take a look at a case here. We get a lot of questions on YouTube or on social media, and the question that I've heard quite a bit is, what do I look for in a doctor who is going to be placing my implants, restoring my case, fixing my mouth, restoring my confidence, and giving me back that smile that I've lost? Here's a case that we acquire a lot of patients that come from all over the place, some from other situations where the prosthesis or the surgery has not gone so well. And this is one of those cases, and you can see here, I don't know if you can visualize on the x-ray, but here we've got an implant in the sinus. So they lost an implant into the sinus. They didn't have the skill set to go retrieve the implant, so they just left it in there. And I can pull up a different view so you can actually see that, that implant in the sinus. And so you can see it right here and here. So the implant is in the sinus, and then the implant's below that, so these two here, there's no bone surrounding them, so they're failing, they're loose and have to come out. The one next to that, same thing, no bone supporting it, so it needs to be removed. And so we'll go back to the panoramic view. Real quick, on the lower front area, there is also an implant that is and this is what it looks like when an implant is failing. So there's no bone supporting it. It's all soft tissue at this point. The implant the bone has now retracted and receded beyond the apex of the implant or the tip of the implant. So this implant will also need to come out. When considering a reconstructive procedure like this, you just can't dumb down the process. You can't dumb down the surgical process, and you cannot dumb down the prosthetic process. And oftentimes we find that that's what's happening in the marketplace. Doctors who take weekend courses are doing these sort of cases. They lose implants in the sinus, or they place implants in bone that they haven't grafted, or they don't know how to graft. This patient spent well over $80,000 to do all this work, and here we are just a few years later having to redo it all. The only reason I even bring this up is for the consumer, it's for the patient, to do your homework and make sure that the doctor doing the procedure has training, has background, has an understanding, surgical training, prosthodontic training. Because if not, you can really end up wasting a lot of money, and not to mention time. I mean, the hours spent in the chair for this patient to get to this stage, I can't even imagine how many hours they spent in the chair, not to mention back and forth to the office. And then to just have it all fail and have to be redone is so unnecessary. You know, here at Trust Implants, we see cases that are 20 years old and they look the same as they did 20 years ago. And so implants are wonderful. It's a great method of replacing and restoring somebody's smile, but you cannot dumb down the process. And unfortunately, the all-on-4 is just that. It's dumbing down the process, avoiding the posterior maxillary sinus, avoiding working over the inferior alveolar nerve. And so, you know, my advice is to find a doctor who understands both surgical and prosthodontic concepts, so that in the end you don't end up in a situation where you have implants lost into the sinus, or implants that are failing, prosthodontics or prosthetics that are failing, because it is an investment. It's an investment in you, and there is almost no better investment. You gain confidence, you gain the ability to masticate or chew your food, you gain your life back in reality. But now this patient has to go through the process all again. They're willing to do that because they understand that the only other option is either a denture or fix this situation of her implants. And she's wanting to go ahead and fix the situation, and we're going to do it properly. We're going to graft the sinus, we'll remove the implant that's in the sinus, we'll remove the implants that have failed, and will restore and reconstruct her case to the new materials, ideal occlusion, so the way that the bite is, the aesthetics, the way it looks, feels, and the balance. And again, as I reiterate over and over in my videos, the biomechanics, how it functions. And this was a biomechanical issue as well. One, because they lost that implant in the sinus, so they avoided placing even the first molars. You know, so biomechanically, all the load is here in the front. So again, similar to the all-on-4, load factors are very much off, and as a result, the patient ends up having to restore or redo her entire case. This whole thing has to be redone. I'm Dr. Willardsen, and thanks for watching.